Bismillahirrahmanirrahim. I start with the name of Allah, most merciful and very kind. CME topic for today by Mother and Child Survival Group of Pakistan is uh, review and overall view of subfertility. Uh, Subfertility is a very common. 1 out of 6 couples are seeking advice, specialist advice for this purpose. In first year of marriage, 84% will conceive with regular upsy intercourse, and the rest 92% will conceive in second year. For evaluation of subfertility, it is very important to have to assess the try to assess the cause of the subfertility, and to give them the evidence-based advice and the options of the treatments, and then has to review of it by a detailed history. Though first year of marriage, with trying regularly is ideal one, but sometimes that we have to refer them early if the age is more than 35, if there are evolutionary disorders, if there is specific fertility problem, if there is endometriosis, and if there is unexplained infertility, and if there is malignancy. Has to overview all of these things in a setup, and then important is to see the patient sometimes needs to be seen in a specialist clinic, and then we have to check the relevant details. And most important is the history. In this age is very important. Menstrual cycle, its regularity, and its duration, and then history of pregnancies, history of ectopic pregnancies, history of miscarriages, sexual and medical history, history of sexually transmitted disease, history of any pelvic and tubal surgery, and history of any drugs, recreational drugs, and the drugs that are contraindicated, and history of smoking, alcohol, and history of folic acid, and history of endometriosis. All these relevant details has to be checked, very important. In the investigations, we have to see the signs of polycystic ovarian disease, signs of hyperandrogenism, acne hirsutism, alopecia, and acanthasis nigricans, endocrine disorders, insulin resistance, and then hyperprolactinemia, and history of thyroid diseases, hyperthyroidism, hypothyroidism, and hyperprolactinemia. And then we have to see on examination the gold standard ultrasound, transvaginal ultrasounds, and then relevant blood test, specifically husband semen analysis, female endocrine profile, LHS, FSH, LH, which is high in cases of primary ovarian failure, and then comes the TSH, LH, testosterone, estradiol, and prolactin. Then we have to see primary ovarian failure and genetic conditions, Turner syndrome, and anorexia nervosa, exercise, weight loss, weight gain, and then we have also to see hypopituitarism, trauma, tumors, surgery, and history of any surgery, and history of endometriosis, fixed uterus, and vaginismus, and dysmenorrhea, and then also hyperprolactinemia. And then in examination finished all this, there are some specific tests as well. As I have told you, male factor is very important, and then there are other factors which has to be considered. An ovulatory disorder, in which the PCO is the most common one, and ovulatory subfertility disorder. Second is this male is 25%, unexplained is 28%. Then there is endometriosis 6 to 8%, tubal factor 15 to 20%, and then there is ovulation disorders 21%. And then other diagnostic male semen analysis, its volume, its motility, and its forward progression, and all these are to be considered, and its content, its quantity, all, and especially the count. This we will discuss in a review. And then comes the other test of female, which are hysterosalpingography, which is very important for the tubal dysfunctions, adhesions, blockage, and it can be done. And then second with the laparoscopy with hysteroscopy can be combined, gold standard, especially for the endometriosis, and it can be, we can treat it peritubular adhesions as well as we can remove the chocolate cyst and others. But it needs a general anesthesia. Then comes the ultrasound with cosine hysterography, cosonography. This also the same as HSG, but in a gelatin containing gel is used for co-contrast sonography. Then the investigations, as I have told you, discussed already, both male and female couples needs to be investigated. First they has to be assessed, they counsel advised option, evidence based, in a meeting. But then for some sensitive questions about the use of smears and breasts, and then each couple has to be then dealt with separately. So management depends upon all this accordingly, the history, the options, and finding a specific problem, and then dealing with the management according to that diagnosis or the specific cause of the fertility. So most important is to see the ovulatory disorder, which is PCO, polycystic ovarian syndrome, is the PCOD is the commonest cause, subfertility and ovulation, and for that signs of hyperandrogenism and insulin resistance, they are sought: acne, hirsutism, alopecia, and acanthosis nigrans. And then the other is the hyperprolactinemia, which is increased also and needs a specific therapy. And then for hyperandrogen insulin resistance, so for that we can use, and ovulatory disorders, we can use this anti-estrogen clomiphene citrate, and another one also available, anti-estrogen and then we can use this GnRH agonists. They are analogs, and they are also used for an ovulation, but they are very expensive. But the most important is that these clomiphene and all, they cannot be used for a long time, but for maximum 12 cycles, as the ovarian response is very high, and an ovarian hyperstimulation syndrome can also take place. so one has to be very cautious. And the analogs are very expensive. There are multiple pregnancies both with जो है clomiphene and GN analogs can result. So ovarian over response of the ovaries must be watched. There's this in this form of this multiple pregnancies. Then is the drugs GN analogs. Metformin is the insulin sensitizer, and it can be combined with also for the efficacy with the clomiphene insulin sensitizer, and it is very helpful because the weight gain is it not only this but also it helps in reducing. If 5% of the weight is reduced, then there is ovulatory function becomes and ovulation regular, and all this helps in solving the problem. And then there are analog insulin plus clomiphene plus GnRH analogs, and hyperprolactinemia can be dealt with bromocriptine. And then there are surgical options like laparoscopy, gold standard. In these peritubal adhesions, they are and can be combined with stereoscopy, and endometriosis and this chocolate cyst, and all these can be and excision with lasers, and all these adheolysis they can be done. Then the tubal surgery also, they can be restored tubal and say microsurgery. And then there is another microsurgery and hyperprolactinemia all can be treated. And that is important, as I have told you, that you have to sort out some problems, and we have to give them the evidence-based advice. And sometimes we diagnose, sometimes we do not diagnose. So there are some distressing effects on the patients, and there are disturbing also for the patients, as they have the drugs have their side effects, and also they have sometimes the treatment failure, and sometimes this effects of these side effects and the treatment failure has a very distressing effect on the couple. So they needs to be counseled before and also after and they should be dealt in separately and combined in a combined meeting, so as to give them the evidence-based advice, counseling, reassurance, and all the options and the evidence-based treatment. So we'll review with another one, and takeaway lesson is pray, praise, trust, love God Almighty Allah, and follow Rasulullah sallallahu alaihi wasallam, our health and survival. And subhanallah wa bihamdihi subhanal azim, wa kafa billahi waliya wa kafa billahi nasira. And all is this, that's very important. Depression and anxiety with depression are very, very common in these couples, so needs to be addressed and has to be dealt with a multidisciplinary team and with multi-speciality approach. So we must not forget our past. दो नीम इनकी ठोकर से सहरा और दरिया सिमट कर पहाड़ इनकी हैबर से राई, दहर में इसमें मोहम्मद से उजाला कर दे. और उसके साथ we should not forget our glorious past, and always we should be asking, praying and talking, worshipping Allah. And we ask always from Allah. हम तो माइल बकरम है, कोई साहिल ही नहीं, राह किसे दिखलाए रहबरे मंजिल ही नहीं. Thanks, and we'll come with another review. Goodbye, best of luck. Thank you very much. Wama alaina illal balagh.